Hello, this is Maria Banos Jordan. I'm the president and founder of the Texas Familias Council. And I'm very, very honored today to have a friend and a wonderful colleague in the Montgomery County community, Adriana Gutierrez. She is the COO of Yes to Youth, which is a mental health organization based in Montgomery County with many, many years of service to this area. And I'm so thankful to have her with us because as we've gone through a very difficult time with the COVID-19 pandemic, and we continue to battle strains of it, the mental health piece is absolutely fundamental to our recovery and our progress from this period. So welcome, Adriana. Thank you for joining me.
Hi, thank you for having me. I really appreciate it. So my name is Adriana Gutierrez, and I'm a licensed professional counselor in Texas, and I am the Chief Operating Officer at Yes to Youth Montgomery County Youth Services. Yes to Youth provides free counseling services to children ages 6 to 17 in the Montgomery County area. We also have an emergency shelter for youth ages 10 to 17. And so most of those are primarily CPS placements, but we do also take what we call community placements. So people in the community that need support for their youth. In addition to that, we have a 24-hour crisis hotline that you can access. So even if you're not a youth or a parent, you can still call and we will try to connect you with resources in our community.
Wonderful, wonderful. I mean, I've had the pleasure of working with Yes to Youth over many, many years. I think in 2008, when I first entered Montgomery County, I got familiar with your programs and have always considered you just one of the pillars of the nonprofit sector in Montgomery County because mental health is so important to all aspects of progress, and specifically now with the pandemic and everything that we've been through. You and I were just talking about the second wave of the pandemic that we call it, because we've been so focused on trying to get people physically healthy and well, and trying to understand the importance of vaccination and staying healthy in general. But a lot of times we forget or we don't understand how the mental health, how the stressors of this has impacted our everyday lives, our family lives, and how it continues to do so. So I wanted to ask you first, how do you think COVID-19 has really directly impacted family life and children in our communities?
I think that it has sort of been the straw that breaks the camel's back. So I think even before COVID, we were already starting to see just a lot of disconnection within families, families really dealing with anxiety, stress, things like that. And then we had COVID sort of come in, and I feel like that was sort of the thing that broke some families a little bit. And what I've noticed significantly, and this is something that I've seen even just speaking to other partners in our community, is that we're starting to see children at younger ages experiencing significant levels of mental health issues. So severe anxiety, severe depression, even suicidal ideation. So children as young as 6, 7, 8 years old are displaying some of these symptoms that we really weren't seeing before COVID-19, or maybe we just sort of weren't aware of it. And I think that's primarily what COVID-19 did for children in a negative way, is it took away their resources. So if we think about developmentally with children, what do children need most of all when they're young? They need to be socialized. They need to be around children their age. They need to learn how to play, how to share, how to interact with people. And when COVID-19 happened, we shut down, right? A lot of children didn't go to school for a year and a half, some up to 2 years. And that really created that barrier of socialization and created more and more anxiety for these children. And so then now you have children going back into public school. And for 2 years, what you've heard was distance, stay distance from people, don't touch anything, don't get close, and then you go to a public school where there's thousands of children walking down the halls at the same time. That for a lot of teens, that created so much anxiety of how do I distance? How do I stay safe? How do I protect myself? How do I do all the things I'm supposed to do to keep myself and my family safe from COVID-19 when I'm in a public setting with thousands of other kids. So it really has just created so much more anxiety for our families.
And that, like you said, especially, we've been having an increase in these issues in communities for several years. I mean, I think that most of us that work at the community level realize, and in our region specifically, we've been hit by one disaster after another, and then the economic hardships of all that linger. So yes, it has been a really devastating experience, I think, for our generation to go through. But it also, like you said, when you're having to pull resources from one arena to another to kind of, keep people moving, we are all in like crisis survival mode, right? And so it is difficult to think, and I think we don't want to sometimes think about how maybe our most vulnerable are suffering silently and not understanding that. With specifically with our Latino community, how do you see that we've responded to this? Because I mean, traditionally, mental health has been a taboo in our culture. People were reluctant to talk about it or understand it, or they attributed certain behaviors to, cultural beliefs. So how do you feel like our community has now been impacted by this with mental health?
So I think just kind of you hit it on the nail. I think culturally, mental health has sort of been taboo or not something we've really addressed in our community, or it's been something where you kind of suck it up. It's sort of that suck it up mentality, right? Like you have it better than what I had it as a child
Yeah.
is a lot of the feelings that or a lot of the sentiments that we hear. And so when you have a child who's, for example, a youth who's experiencing lots of anxiety going to school, it's hard for the parents to understand that. I've noticed it, especially in our Latino community, because their response is, well, at least you get to go to school. I didn't get to go to school. Right. And so they don't really understand the struggle. They don't really understand that, yes, I have these privileges and I'm also suffering and I'm also having difficulty. It's almost this mindset of like, you have privilege that I didn't. And so now you should be fine because you have better things than I did when I was a child. And so that's one of the biggest struggles I see with our Latino families is that disconnect of the generations and the culture. And then when we move into access, right? So usually what we'll see is parents will have their children seek services because the school sort of requiring it, because the child is either missing classes or failing, and so the school has to intervene to say, hey, you need to take your child to services or they're going to fail or they're going to get kicked out or they're going to end up suspended or whatever. And so then that's when they'll look for services for their child. But even then you have to educate the family. You have to really pull in the parents to help them understand that mental health is real. Just because they have privileges doesn't mean that they also can't be experiencing stress or anxiety or depression. And then helping them understand that the medication piece as well. I think that's another layer that Latinos really struggle with. It's like, I don't want to medicate my child. I don't want them to be on medication, or there's a fear of if they're on medication that they're going to become addicted or it's going to become this worse problem. And so helping them understand that sometimes antidepressants can be really helpful. Sometimes anti-anxieties can be really helpful. And so helping them find that balance between their fears and supporting their child.
Yes, and do you feel like the adults, the parents themselves are aware that they have been struggling? I mean, I know, obviously when the child is in school and it's brought to their attention that your child is struggling, are they able to make the connection to, well, I'm struggling too. And I think that you and I have spoken about this, and certainly when we're working with first generation immigrant communities, we see a lot of isolation, adjustment issues, having to have left the the extended family or supportive network back home and having to recreate community here. All those things do impact mental health in general for everyone. But then going through a pandemic, and not really understanding how that's adding another layer to the adult. I mean, do you feel like they are more receptive to receiving the mental health services than they might have been prior to this pandemic?
I do see that. I think that because mental health has just been in the spotlight so much since COVID-19, I really do feel like our communities are starting to go, oh, wait, maybe my child isn't chiflado. Maybe there's actually a real
Right.
thing going on here, right? And so they are a lot more receptive. And I think too, I think one thing, like, for example, at Yes Youth that we offer is having those bilingual services. So we have bilingual therapists.
Mhm.
I think that provides that support because we're able to do counseling in the language that they understand. We understand the culture. And then through that, there's word of mouth of like, hey, this is a safe place to come and get resources. And so it helps families understand that they're not alone, and it helps them kind of go, oh, there's other parents experiencing this same thing with their child or even in their family system. So I think that it does I think they are more like our Latino population is more open now to receiving services. And I think primarily because um, everybody is experiencing stress at this point. It's become
Right.
almost like, oh, wow, it's not just me. This is everybody. And maybe we don't have to live like this anymore.
Right, right. I mean, and I think that that's both the challenge for us in working our way through the pandemic, is understanding that it does take time for a community to kind of bounce back, but there is there's a sense of strange connection that we are all suffering together, right? That we're all
Mm-hmm.
struggling with the same problems. Like we said, economic hardship as well as the other stressors from dealing with the children adjusting and ourselves adjusting. What do you think can help at home, especially right now? We were talking about the lack of therapists, the lack of, I mean, so while it's great that families are mindful now that they might need support, that their children need support, and they're asking for help, but if there is difficulty accessing that help because there's so many people right now asking for help, what can we do in the interim, I guess, while we're trying to make these adjustments? Right now, we're in the Christmas break, and so families are back together. So that, that could be a bad thing for some families if they're having a lot of issues. What are some simple steps maybe families can do?
Yes, I think that one thing that a lot of families don't always do because we're all just so busy, right? We're kind of ships of the night sometimes. We're going to work, going to school. I think making time to quality time as a family. So simple things like having one meal together, whether it's breakfast, lunch, or dinner, having a meal together and checking in. How has your week been? What are you guys planning for this week? What are we doing today? Like just having conversations to get to connect with your family. I think as well as parents, giving ourselves grace, that maybe, it's okay if the dishes aren't done today, right? Like spending
Right.
quality time with your child is actually more important than getting the dishes done. And those are the things that your child's going to remember and hold on to more. And when they are feeling upset and anxious, they're going to recognize that you're a safe person to come to. And
Mhm.
so, sometimes we have to also figure out what's worth our energy today,
Yeah.
especially when we're just so sucked, right? Our energy's going everywhere right now. Really trying to find that balance of it's okay if things aren't perfect, right? And I think that
Yes.
that's one thing Latinos in particular, we have that wanting to present ourselves perfectly and make sure our
Right.
children look great and our house looks great and everything, and that's important and that's a great value to have, but we also need to balance that with spending time with our children and spending quality time, right? So if it's, simple meals together, checking in. One thing I love to tell families is, have you hugged your child today?
Yes.
I think
Yes.
sometimes we'll go days without hugging our children, right? There's
Right.
actually some research that suggests that children need about 8 to 10 positive physical contacts a day to build their self-esteem. So
And
that
even
could be
our older kids, right? Like
even
even
our
our
older, like our
teens, right?
teens,
Yes.
yeah, like hugs, a pat on the back, a squeeze of the hand, ruffle of the hair. Those are all positive interactions.
Mhm.
And are we doing things like that? Are we even connecting physically with our children in those ways? So
Hmm.
those are really simple things that you can do with your children to connect. And it may feel weird at first if it's not something you've used to do, but you'll see the response from your child. It can be really changing. My children at this point, they'll come to me like, Mom, you haven't hugged me today. I'll be like, you're right, I haven't. I
Oh,
need to hug you today, right? So they almost like they crave it at this point. So
yeah. I mean, and I think that that's such an important point to make, because one, even those of us that are huggers, and we get so caught up, and I think right now, because we're trying to find our routines again, we are overwhelmed in some senses with so many things, trying to figure out what steps to take next in life and work and everything, that we do forget. We forget
Mhm,
that we haven't hugged on our children. And then there are the families that came from a culture in their families where they never hugged. Maybe their parents never hugged them or never told them that they loved them.
mhm,
And we pass these on, right? I mean, these behaviors are sometimes, whether we realize it or not, we pass those customs on to our children. So I think that that's such an important point to make, because it is part of the healing process too. But it's
mhm,
just an everyday need for
mhm,
children. Um, so as far as uh, I want to ask you a little bit about, besides the focus on everyday personal care and the care of our child, married life, marriages, for example. We know that domestic violence cases went up significantly,
mhm.
especially at the beginning when we were seeing people, isolated, locked in, that sort of thing. Um, it how do you emphasize to a family how important it is for the married couple to also care for their relationship and their
Mhm.
stress in the marriage?
For sure, yeah. So our children will model, as parents, we need to model what we want our children to see. And what I always tell families is, what sort of relationship do you want your child to have when they're an adult? That's what you should be modeling for them in your relationship, right? So if you want them to have a caring partner, then that's what you should be modeling with your
Mhm.
partner. I think one thing too is also, there's a researcher, his name is Gottman is his last name, and I can't think of his first name, but he does lots of research on marriage and families. And he talks about the 6-second kiss every day. So kind of like the same thing with the touch with your child, the positive touch. He encourages couples to have a 6-second kiss every day with each other,
Mhm.
right? And it doesn't need to lead to anything else. It's just having that intimate moment together to build that connection, checking into making sure that couples are really spending time together. And that can be really hard to do when you have a family and
Mhm.
you're working. But even if it's checking in, just a few minutes at night before you go to bed or in the morning before you guys go off to work, but just doing quick little things like that to see how your partner's doing. um, but yeah, I think, and especially right now, kind of thinking about COVID and the long-term impacts, couples have really been facing lots of struggles, right? So now they have children who are dealing with lots of stress and anxiety. They themselves are also dealing with stress and anxiety. They may have lost a job during COVID.
Right.
And then now we're seeing the cost of living is just significantly increased this year. And so, there's so many things that could be potentially negatively impacting relationships. So if there isn't a foundation of support and caring, then those things can really, really lead to breaking marriages apart.
Absolutely. And I was just thinking as you were speaking, as a woman, as a mom, I admit, especially the first year and a half or so before, especially when we were very vulnerable without vaccinations, um, my mama bear, instinct was in very high. I mean,
Mm-hmm.
I could tell that, I was ultra acutely aware of, were my children sanitizing their hands? Were they wearing their masks? I have adult children, an adult child. And so, where was he spending his time to not be exposed? And just kind of like being overtly worried about these things all the time, trying to keep the family healthy. And it was such an intense, looking back on it now, such an intense state of concern for such a long time that, you just didn't realize that you weren't really taking the time for yourself, or spending the 6-second kiss with your husband, the little things that you needed to nurture because you were in this heightened sense of, crisis for a while.
Yeah, yeah. Yeah, and that's sort of our fight or flight response, right? So when we are in fight or flight, we're not really going to be able to think things through. We're just reactionary at that point. And I think
Mhm.
that's what's happened to lots of people in general is we're living in fight or flight, or we've been living in fight or flight
Yeah.
since 2020. And so it's, our brains are then, moving towards reactionary responses instead of really thinking things through and thinking, okay, what are my needs, what are my family's needs, what can I give, kind of, we just kind of do because we're just trying to survive.
Right, right. So that brings me to my next question. Um, Aside from being aware in the family what our mental health needs are, making sure that, everybody's taking care of themselves physically and trying to optimize their health in general. I mean, our council's really been talking, especially with our Latino, our immigrant communities, about returning to natural remedies or customs that we've held very close and dear in our culture for generations, because they are healthy type of focuses, about eating more cleanly, more
Hmm.
naturally, being more mindful in your day, spending time in nature, instead of having a Coke, having, an herbal tea, we're trying to engage in that way to emphasize the importance of ongoing health. But what else can communities do in general? Like, you and I both, work in the community constantly, and so we're seeing what's there, what we wish were there. But how do you think we can develop better support systems in communities, to help us, get beyond this and become better adjusted?
I think that's the $1 million question, right? I think that one thing that I think is very successful is when there's collaboration between communities, right? So when you have nonprofits working together with community partners, working with neighborhoods or churches where families already exist, I think that's really one of the biggest and easiest ways to support families, and that families then don't have to add an additional layer of burden to try to seek out services. And so, really making those connections as a community truly with the resources that are there, and bringing them all together so that our families can have easy access to them, and then hopefully utilize them a lot, just utilize them more.
I think that that's so key, the collaborative piece. And I would say what I've kind of seen in the last year or so, is everyone trying very courageously to hold things together and move forward, whether it's school districts, and I realize different school districts have different resources internally. Some are more reliant on those collaborations outside of what they might have because they need that help. But it's important for not just families, but for also institutions to understand that you can't do it alone, right? Like, you
Hmm.
need help. Like, that's,
Hmm.
I think, one of the big lessons of this pandemic is that we
Hmm.
do need each other. We do need that support. And maybe there are things that I can't provide, but there's a partner or there's an organization that may be able to provide that. And by pulling those resources, we can reach more people.
Definitely, definitely.
Yeah. So, and I think that in your field, specifically with mental health, we were talking about the need for more funding, for resources, for professionals, for outreach. I don't, do you see that going away anytime soon? Because I kind of think that this is a very long-term um, issue that we need to just confront and invest in, if we are going to successfully progress away from this pandemic.
Yeah, no, I don't foresee this going away anytime soon. I think this is going to be something we're going to be struggling with for a good at least 5 years before we start to see sort of more of a balance. I know that there are some community partners that are looking at legislation in the state of Texas to try to get more mental health funding, and I know that the federal government as well has been looking at funding for mental health services. So I'm really hopeful that the pipelines of funding will come through maybe next year, hopefully, for additional resources and because it's not just our agency, there's agencies across the county, across the United States, really that are struggling with finding enough therapists to meet the needs of the community. So it's really just there's a shortage of mental health providers, especially bilingual providers.
Yeah.
Just the needs are significant.
And so I would venture to say that you would definitely encourage our young Latinos that may have considered a career in mental health or in social services to definitely pursue that path, because it is an important piece for the community.
Definitely, yeah. Unfortunately, there's job security in this. I'd love to say that, we wouldn't need any more therapists, but there is that need, and especially Latinos and bilingual people really should consider this path. I think it's a very rewarding path. You get to see families, the shift of them coming in desperate need for support, and then when you're done, in a couple months and a couple weeks of sessions, you really start to see them building their skills, building their self-esteem, really trying to understand their new worldview and in such a positive way. And it's so rewarding to see that.
And you, yes, at Yes to Youth for years before the pandemic, you've had women's groups for moms, which I believe have been very successful
They are
in
very, yeah.
creating community and support.
Hmm. Hmm.
And so I've loved that y'all have committed to that, and that is an ongoing resource for your organization, because it really does speak to the need that I see out there when so many women are trying desperately to hold it all together, and especially in these times, but they're needing that support system.
Yeah, so we have our Hispanic moms group. We have a Spanish-speaking parenting group that really have been super successful and great resources for our Latino families to seek supports. One of the other things that we recently started this year that has been extremely successful, and most of the girls in the group are Latinas, is a girls group. It's a teen girls group,
Awesome.
and so that has been super successful. We have anywhere upwards of 15 girls that show up every Monday
Oh,
and
that's
really just
wonderful.
work together. They have such shared experiences of, anxiety and all the things going on in their
Mhm.
worlds. And it's been very, very supportive for them to see other girls experiencing similar things and really finding those networks and supports. So that's been one of the one new groups that we started this year that has really just been amazing to see.
Oh, that's wonderful to hear, because I'm a big proponent of that. I think that there's a lot of nurturing that we can so easily do if we just build the spaces for people to come and to begin that support network. So thank y'all for doing that. I wanted to ask you real quickly about vaccinations, because that was, if you look at the this journey that we've all been on with this pandemic, from the initial shock of what is going on, what do you mean there's a pandemic, to then trying to protect your loved ones, and like I said, being in this heightened sense of crisis for so long, and then the vaccinations were introduced. Some people believe they were introduced too quickly, not understanding that some of these things had been researched for years, and then they were made available. But how did you see that whole piece, that introduction of the vaccine, that choice to vaccinate or not vaccinate, for different reasons, whether they be political or religious or just fear? But how did you see that anxiety surrounding that those choices impact families?
I saw that's very interesting because I saw that a lot. So what I would see, I primarily we work with youth here. And so I would see lots of teens or children who wanted to get vaccinated, but their parents wouldn't allow them to out of fear
Um,
or out of political issues or religious issues. And so that was one thing that often we would have to kind of talk about. And obviously, we can't tell them what to do, but we just kind of walk through, okay, pros and cons, fears, if you aren't able to get vaccinated, then what are some other ways you can protect yourself? What are some things we can do to, so we kind of had to look at other options for them. And so but yeah, I saw and I think a lot of that times it was a generational gap of the fear
Mhm.
of the unknown. And then you have younger children who are able to read and understand maybe things in English and listening and reading things that their parents couldn't really quite understand, that were like, no, this is safe, let's get vaccinated. And it was definitely a struggle.
That's interesting. The lack of especially in the beginning stages of getting access to the information as it was coming out and
Mhm.
changing so quickly, whereas the bilingual youth were able to access that information much more easily than maybe their parents. So
Mhm.
that created some tension. Another thing I saw, I wondered if you saw this too. Initially, there was a big push to get the elders vaccinated, right?
Mhm.
And that was initially the first stage of people who were eligible, but I saw it very commonly in our Latino communities where the younger children or grandchildren were, taking their grandparents to go get the vaccine right away, but then they themselves weren't getting the vaccine once it was made available to them. So there was, like you said, there was an interesting just response or reaction to the information or understanding of how we were being impacted as a family by
Mhm.
these decisions and these choices.
Yeah, I do think some of that was the messaging, especially in the beginning, was, vulnerable populations were the elderly, right? And so you kind of,
Yeah.
there was sort of this idea of like, oh, it's only going to impact the elderly, right? And so
Right, right.
I think that once we actually saw what was happening, it's like, oh, wait, no, this can impact anybody at any point in their life. I think that that's when maybe we started to see a shift of like, oh, we should all maybe look at getting vaccinated.
Yeah, so it has been an ongoing. We, like I said, we had a vaccination drive this weekend, and we had two first timers that were vaccinated, and uh, it's interesting the choices that we have when it comes to health, and especially during a pandemic. But I guess that is the extra burden of trying to understand the balance of physically protecting ourselves, either through behaviors or vaccinations, and then mentally,
Mm-hmm.
protecting ourselves. And
Mm-hmm.
I think that that's the one that right now we're struggling with to understand how have we been impacted by this, and what can I do to begin to address how I've changed, maybe, right?
Mm-hmm. Yeah. Yeah. Yeah, it's definitely, I think people had to kind of stop and ask themselves these questions of, what is this? The vaccine was more than just a vaccine, right? It was almost like a life and death decision for some people.
Right.
It was a cultural decision. It was a political decision. It was a
Yeah.
religious decision. It impacted so many of our values. And sometimes some people's decision may be very contradictory to their peers or their friends. And so that was, I think all of that sort of created additional stress around the vaccines. It wasn't just a vaccine. It was more than that for a lot of people.
Yes, I agree. I agree. And especially in our communities, where we see high numbers of vulnerabilities because of diabetes and high blood pressure
Mhm.
and other underlying conditions that, like you said, there were life and death decisions that were, being thrust upon us, and we were being challenged, on all
Mhm.
fronts of how do we even view public health?
Mhm.
And I think so. As a mental health professional, and as you're looking at the next steps, the new year is coming in, and that brings us to a point of reflection, but also planning for what can we do, what have we learned, and what can we take forward. So as a mental health professional, what would you like for us to incorporate in our thinking going forward, in this new year, as far as the component of mental health, and everything that we've talked about today with the pandemic and beyond?
One thing that resonates with me, and I feel like even myself, I've had to do this for myself, is giving myself grace. I said that earlier, but I
Mhm.
think that in 2023, we need to give ourselves grace. We're slowly trying to move away from this pandemic. We are struggling with a whole new set of issues, whether they're financial, stress, maybe even still illness.
Mhm.
And I think that our worlds are different now. And I think that we need to give ourselves that grace of our world is not the same as it was 3 or 4 years ago. This is a whole new ball game that we're in. And we've got to kind of relearn how to play the game, right? And through that, it's okay to make mistakes. It's okay to not be perfect. It's okay to struggle and ask for help. I think that's what I would think as looking at mental health in general. The less that we put pressure on ourselves to do it all, the more that we'll be able to really do it all, right? Because then we're seeking supports and we're doing we're kind of pooling everything that we have, all our accesses and all our resources.
Yes, absolutely. 100% agree. I think that, um, one of the things that came online this past year was the 988 number
Mm-hmm,
for mental
mm-hmm,
health, the crisis line. So I'm happy to see, that, there are new resources coming online for communities to access and to be more open about talking about mental health. Because I think, also for me, it is in 2023, the word grace really is important. I think that's it's directly connected to our sense of love for self and love for one another,
mm-hmm,
love and community. And really, you know, when you said that it's okay to not be perfect, I think that our society tends to focus so much on that idea of perfection and achievement, that when we're pushed back by something so historic and so devastating like this pandemic has been, it really takes us off of our out of our comfort zone,
mm-hmm,
and then we're so desperately trying to get back to whatever that normal is, and deny that we're still struggling.
mm-hmm.
um,
Or that our
so
normal is going to look very different now.
very different,
Mm-hmm,
absolutely. And
mm-hmm.
that's okay. I mean,
And
that's
that's
actually
okay. Yeah,
good. That's
that's good.
that's
Yeah.
really okay. We're all learning, new things,
Mm-hmm.
and that's okay. Was there anything else that you would like to share, Adriana, before we close our conversation today?
No, I just want to thank you for allowing me to talk to you today and share my thoughts. And we're here to support. If anybody needs anything from Yes to Youth, we will do our best to offer that.
Well, I appreciate you all. You have been wonderful this past, couple years through the pandemic. I know that I can, call you, and you're going to give me your feedback, your opinion, what's going on with our communities, and it's so important to have people that are loving on our communities and our families that are in these positions to help them heal and move forward. And yes, I think that one of the lessons from this pandemic is to, appreciate those of you that are in the mental health field. And that is a heavy burden, especially these days. And when you're seeing people deal with hopelessness or isolation, returning to the fundamental concept of love for one another, and healing. So thank you so much for being there. And I will share the phone number to Yes to Youth once we upload this video, so that people can access that helpline, and if they live in the area, because you serve Montgomery County, so it is the whole
Yes.
county.
The whole county, yes. And even if they're in Harris or other surrounding counties, we will do our best to provide resources or support. So
Yeah.
yeah, so we're available 24 hours a day if anybody needs, any sort of resource.
Yeah, and that's a big, especially for this area, outlying counties of the metropolis that is Houston.
Mm-hmm,
Is there We've seen so much population growth, and it's continuing, and so
mm-hmm,
that is straining, our ability to reach everyone. So getting people familiar with who's out there, what those organizations do, like Yes to Youth, and making sure that especially our Spanish-speaking communities know that there are caring people in these positions that can reach out to them. So thank you so much again, Adriana. I
You're
appreciate you so
welcome.
much, and your wisdom today. And we will be sharing this message with our communities, and hopefully people will have this discussion over the Christmas break and ongoing about how they're doing in their families with mental health, and that it is something that we're all needing to address and support one another with.
Thank you.
Thank you. And so, yes, I will be posting information, contact information with this video. And please do reach out if you need anything. And Merry Christmas and Happy New Year to everybody. Thank you, Adriana.